हेलो दोस्तों, वेलकम बैक टू आवर चैनल नर्स अड्डा। आज हम एक नए सैम्पल पेपर के साथ वापस आ चुके हैं जो कि होने वाला है एम्स नॉर्सेट 2026। जैसे कि आप लोग को पता है, एम्स नोटिफिकेशन आउट कर चुका है। सितंबर में होने वाला है आपका एग्ज़ाम। ठीक है, तो बिना टाइम गवाए आज का सेशन स्टार्ट करते हैं। ये सेट हमारा होने वाला है 8 सेशन। ओके, टोटल क्वेश्चंस 100 रहेगा, जैसे कि पहले भी ऑल सेट में 100 रहा है। ठीक है, टाइम 90 मिनट्स एंड मैक्सिमम मार्क्स 100। इंस्ट्रक्शंस आर ईच क्वेश्चन कैरीज 1 मार्क। सेलेक्ट द मोस्ट अप्रोप्रिएट आंसर एंड अटेम्प्ट ऑल क्वेश्चंस। ठीक है, नर्सिंग के क्वेश्चंस होंगे इसमें 80, जनरल नॉलेज 6, इंग्लिश 4, कंप्यूटर 5, मैथमेटिक्स 5। So, total questions are 100. Session A, Nursing. First question. A newborn receives vitamin K immediately after birth to prevent. Your correct answer is option B, hemorrhagic disease of the newborn. Next question. Which vaccine under the universal immunization program is administered by the intradermal route? Your correct answer is option C, BCG vaccine. Which of the following is the most reliable indicator of the health status of a community? Your correct answer is option B, infant mortality rate. During the active first stage of labor, cervical dilatation ranges from. Your correct answer is option B, 4 to 10 centimeter. Next question. A 9-month-old infant is unable to sit without support. The nurse should suspect delay in which developmental domain? Your correct answer is option B, gross motor. Next one. Which vaccine is given as the birth dose under the universal immunization program? Your correct answer is option C, OPV vaccine. Which hormone is primarily responsible for milk production after childbirth? Your correct answer is option D, prolactin hormone. The normal fetal heart rate ranges between. Your correct answer is option B, 110 to 160 beats per minute. Next question. Which method is considered the most effective temporary spacing method of contraception? Your correct answer is option C, copper IUCD. Which of the following diseases is not included in pentavalent vaccine? Your correct answer is option D, measles. Which of the following is a live attenuated vaccine? Your correct answer is option C, BCG vaccine. The first breast milk secreted after delivery is called what? Your correct answer is option C, colostrum. Which of the following is a danger sign in a newborn requiring immediate referral? Your correct answer is option B, refusal to feed. Next question. During antenatal examination, the fetal presenting part is identified by which Leopold's maneuver? Your correct answer is option C, third maneuver. Which indicator is calculated as the number of maternal deaths per 1 lakh live birth? Your correct answer is option C, maternal mortality ratio. A 6-month-old infant has received all vaccines as per schedule. Which vaccine is due at the 9th-month visit under Universal Immunization Program? Your correct answer is option C, MR1. Next question. A postnatal mother complains of breast engorgement on the 3rd day after delivery. Which nursing advice is most appropriate? Your correct answer is option B. Express a small amount of milk before feeding. During an immunization session, a child develops itching, wheezing, and difficulty breathing within a few minutes of vaccination. What should the nurse do first? Your correct answer is option B. Administer adrenaline immediately. Next question. A woman at 32 weeks of pregnancy presents with painless, bright red vaginal bleeding. Which condition should the nurse suspect first? Your correct answer is option A, placenta previa. Next question. During a growth monitoring session, a child's weight falls below 3 st on the WHO growth chart. How should this child be classified? Your correct answer is option C, severe underweight. Next question. The most reliable sign of pregnancy is? Your correct answer is option C, fetal heart sounds heard by Doppler. The active management of the 3rd stage of labor, AMTSL, primarily aims to prevent what? Your correct answer is option B, postpartum hemorrhage. A postpartum mother has a bogey uterus with excessive vaginal bleeding. What should the nurse do first? Your correct answer is option B, massage the uterine fundus. A nurse is caring for a patient with left-sided heart failure. Which assessment finding is most likely? Your correct answer is option C, pulmonary crackles. Next question. A patient develops itching, flushing, and difficulty breathing within a few minutes of starting a blood transfusion. What is the nurse's first action? Your correct answer is option B, stop the transfusion immediately. A patient with COPD is on oxygen therapy. Which oxygen delivery device provides the most accurate oxygen concentration? Your correct answer is option C, Venturi mask. Next question. Which assessment finding is most characteristic of hypocalcemia? Your correct answer is option A, Troche's sign. A patient with Addison's disease is most likely to present with Your correct answer is option B, hyperpigmentation and hypertension. Which electrolyte imbalance is most commonly seen in Addison disease? Your correct answer is option B, hyponatremia and hyperkalemia. Next question. A patient develops sudden chest pain and ST segment elevation on ECG. Which cardiac biomarker rises earliest after myocardial injury? Your correct answer is option C, myoglobin. Next question. A patient with iron deficiency anemia is most likely to have. Your correct answer is option B, microcytic hypochromic RBC. Next question. Which of the following is the most common complication of uncontrolled hypertension? Your correct answer is option B, stroke. Next question. A patient with Graves' disease is expected to have. Your correct answer is option C, weight loss and heat intolerance. Next question. A patient with myasthenia gravis is most likely to complain of. Your correct answer is option B, muscle weakness that worsens with activity. Next question. A patient suddenly develops pain, pallor, pulselessness, paresthesia, and paralysis in the right leg. The nurse should suspect what? Your correct answer is option B, acute arterial occlusion. Next question. Which antidote is used in heparin overdose? Your correct answer is option B, protamine sulfate. Next question. Which drug is commonly prescribed for the emergency treatment of anaphylactic shock? Your correct answer is option B, adrenaline or epinephrine. Which route of administration provides the fastest systemic drug action? Your correct answer is option C, intravenous. Which adverse effect is commonly associated with long-term corticosteroid therapy? Your correct answer is option C, osteoporosis. Which medication should not be administered with milk due to reduced absorption? Your correct answer is option B, ferrous sulfate. Next question. Which nursing theory emphasizes self-care as the primary focus of nursing? Your correct answer is option B, Dorothea Oram. Next question. Which position is most appropriate for a patient receiving a soap water enema? Your correct answer is option C, left lateral or Sims position. Next question. Which pulse site is commonly used while performing CPR or cardiopulmonary resuscitation in an adult? Your correct answer is option C, carotid artery. Next question. The normal range of central venous pressure or CVP is? Your correct answer is option B, 5 to 10 centimeter of water. Next question. Which of the following is the most effective method to prevent hospital acute infection? Your correct answer is option C, hand hygiene. Next question. Which chamber of the heart has the thickest muscular wall? Your correct answer is option D, left ventricle. Next question. The functional unit of the kidney is? Your correct answer is option C, nephron. Which endocrine gland is known as the master gland of the human body? Your correct answer is option C, pituitary gland. Next question. Which blood vessel carries oxygenated blood from the lungs to the heart? Your correct answer is option D, pulmonary vein. Next question. Which part of the brain is primarily responsible for maintaining balance and coordination? Your correct answer is option B, cerebellum. Next question. Which symptom is considered a positive symptom of schizophrenia? Your correct answer is option C, hallucination. Next question. A patient with depression repeatedly says, I am burdened to my family. This statement reflects what? Your correct answer is option B, low self-esteem. Next question. Which defense mechanism involves attributing one's own unacceptable feelings to another person? Your correct answer is option B, projection. Next question. Which medication is considered a mood stabilizer in bipolar disorder? Your correct answer is option C, lithium carbonate. Which type of hallucination is most commonly observed in schizophrenia? Your correct answer is option C, auditory. In a research study, the variable that is manipulated by the researcher is called. Your correct answer is option B, independent variable. Which sampling technique gives every member of the population an equal chance of being selected? Your correct answer is option C, simple random sampling. अगर आपको हमारा सीरीज़ पसंद आ रहा है तो प्रीवियसली जो जो हमने अपलोड किया है वो भी जाके चेकआउट करिए और रिवाइज करिए. मूविंग टू द नेक्स्ट क्वेश्चन. क्वेश्चन नंबर 58. Which management principle states that one employee should receive orders from only one superior? Your correct answer is option B, unity of command. ये मैनेजमेंट का क्वेश्चन है. नेक्स्ट क्वेश्चन. Which nursing audit is conducted while patient care is being provided? Your correct answer is option B, concurrent audit. Next question. Which leadership style encourages active participation of team members in decision making? Your correct answer is option B, democratic. Next question. A patient with type 1 diabetes mellitus is most likely to develop what? Your correct answer is option B, diabetic ketoacidosis or DKA. Next question. Which electrolyte imbalance is most commonly associated with acute pancreatitis? Your correct answer is option B, hypocalcemia. Which condition is most common cause of nephrotic syndrome in children? ये बहुत बार रिपीट हुआ है प्रीवियस ईयर में. So here the right answer is option B, minimal change disease. Next question. A patient with rheumatic heart disease is most commonly affected by which heart valve? Your correct answer is option C, mitral valve. A patient complains of severe chest pain that increases on deep inspiration and coughing. Which condition is most likely? Your correct answer is option B, pleurisy. Which condition is commonly associated with coffee ground vomiting? Your correct answer is option B, upper GI bleeding. Which type of shock is commonly seen after a severe allergic reaction? Correct answer is option D, anaphylactic shock. A patient with hyperparathyroidism is most likely to develop what? Your correct answer is option B, hypercalcemia. Next question. Which heart sound is produced by the closure of mitral and tricuspid valves? Your correct answer is option A, S1. A patient with chronic asthma suddenly develops silent chest, severe breathlessness and cyanosis. This indicate what type of condition? Your correct answer is option C, status asthmaticus. A patient receiving warfarin should undergo regular monitoring of which laboratory test? Your correct answer is option B, INR or International Normalized Ratio. Next question. Which artery is commonly used to assess circulation in the lower limb? Your correct answer is option C, dorsalis pedis artery. Next question. A nurse is caring for a patient with glaucoma. Which instruction is appropriate? Your correct answer is option C, use eye drops regularly as prescribed by doctor. A patient with Parkinson's disease is most likely to exhibit. Your correct answer is option A, resting tremor. A patient with chronic liver disease is at increased risk of bleeding primarily because of. Your correct answer is option B, decreased synthesis of clotting factors. Which finding is most characteristic of hypoglycemia? Your correct answer is option C, sweating and tremors. Next question. A nurse is caring for a patient with increased intracranial pressure. Which nursing intervention should be avoided? Your correct answer is option C, frequent suctioning without indication. Next question. Which laboratory value is most useful for evaluating long-term glycemic control in a patient with diabetes mellitus? Your correct answer is option C, HbA1c. A patient with hyperthyroidism is most likely to present with what type of symptoms? Your correct answer is option C, weight loss, heat intolerance and tachycardia. तो इसी के साथ हमारे नर्सिंग सेक्शन का एंड होता है. नेक्स्ट सेशन है हमारा सेक्शन बी, अदर सब्जेक्ट्स लाइक कंप्यूटर, इंग्लिश, मैथ्स एंड रीजनिंग एक्सेट्रा. चूज द करेक्टली स्पेल्ड वर्ड. Your correct answer is option C, accommodation. Choose the synonym of diligent. Your correct answer is option C, hardworking. Which vitamin is synthesized in the human skin on exposure to sunlight? Your correct answer is option C, vitamin D. Find the next number in the series 3, 6, 12, 24 or 48. Your correct answer is option C, 96. Which of the following is the smallest prime number? Your correct answer is option C, number 2. Which key is commonly used to refresh a web page or Windows desktop? Your correct answer is option B, F5. Next question, which of the following is an operating system? Your correct answer is option B, Windows 11. The shortcut key Ctrl plus C is used to. Your correct answer is option B, copy. Which is the largest organ of the human body? Your correct answer is option C, skin. Find the missing number. Your correct answer is option C, 80. Which of the following is not an input device? Your correct answer is option D, monitor. A train travels at a speed of 60 km per hour. How much distance will it cover in 2.5 hours? Your correct answer is option C, 150 km. Explanation is, using this formula we can find the correct answer. The formula is distance is equal to speed into time. So here speed is 60 and the time is 2.5. By this we get the correct answer, 150 km. Next question, which of the following file extensions is used for a Microsoft PowerPoint presentation? Your correct answer is option C, PPTX. If book is coded as CPPL, then pen is coded as what? Your correct answer is option A, QFO. Next, which of the following is known as the Pink City of India? Your correct answer is option B, Jaipur. Next question, a patient is prescribed 1500 ml of IV fluid to be infused over 12 hours. What should be the infusion rate in ml per hour? Your correct answer is option B, 125 ml per hour. Explanation is, infusion rate is total volume divided by time. The total volume is 1500 and the time is 12. By this we get the right answer, 125 ml per hour. Next question. Which Indian state is known as the Spice Garden of India? Your correct answer is option B, Kerala. The Constitution of India came into effect on which year? Your correct answer is option B, 26 January 1950. Which is the longest river in India? Your correct answer is option C, Ganga. The average of 12, 18, 24, 30 and 36 is? Your correct answer is option C, 24. Explanation is average is equal to total sum by the number of quantities. So by this we get the right answer 24. तो इसी के साथ हमारा टोटल 100 क्वेश्चंस कंप्लीट होता है। तो आज का मोटिवेशन लाइन है टुडे सैक्रिफाइस इज टुमारो सक्सेस। आज मेहनत करोगे तो कल सक्सेस पाओगे। ठीक है, बार बार एक ही एग्ज़ाम के लिए पढ़ने से अच्छा है एक ही बार अच्छे से पढ़ाई कर लो और एग्ज़ाम क्रैक करो और फिर बाकी की ज़िंदगी अच्छे से जियो। ठीक है, अगर आपको हमारा वीडियो थोड़ा सा भी हेल्पफुल लगे तो चैनल को सब्सक्राइब करिए, फॉलो करिए और कमेंट करना ना भूलिए। थैंक यू फॉर वॉचिंग द होल वीडियो।